Hello, good evening, everyone. My name is Dr. Hong Lian from Elder Love Living Care Center at Missi Care. Personally, I am professionally and personally, I'm a consultant physician and nephrologist. This talk is given in conjunction to the Immunization Awareness Month. I believe since the COVID-19 era, you guys have been hearing a lot about vaccination and immunization. So I think this talk is very useful to help you basically to understand better regarding what does it mean by vaccination and immunization. And also I'm going to give you a few examples of the importance of vaccination, as well as giving you some example of vaccines available. So what does vaccination and immunization means? Vaccination is basically the act of getting a vaccine to produce immunity to a specific infection or disease, whereas immunization means becoming immune to a specific infection or disease, typically through vaccination. Some diseases, after you get infected by the disease, you get immunized yourself, but not this doesn't apply to all infection. Public Health England mentioned that vaccines saved life, and in fact vaccines are the second most important and most effective public health intervention in the world after clean water. This just shows you how important it is for vaccination. So it's vital for everyone that is eligible to get vaccinated, because vaccines definitely save lives. What is a vaccine? Vaccine is basically a substance that teaches the body's immune system to recognize and to protect against a disease caused by an infectious agent. It can be a virus or it can be a bacteria. I think if you have time, you can basically, read through all this historical perspective of vaccination. It's very interesting because vaccine, it has not been in the market for 10 years or 20 years. Actually, vaccine has been produced since about 220 few years ago. These are the historical perspective. To give you an example, basically, in the 1950s, there are still a lot of people infected in polio. Maybe a lot of you would understand what polio is. Basically, it's a viral infection that causes paralysis in the people who get infected. Very, very severe infection, basically. And then the people who get infected might get paralyzed, and some of them might even not able to breathe and have to live in the iron lung for a prolonged period of time until the day they die. It's a very debilitating disease. If you Google iron lung, I think you understand what I mean. So these are the historical perspective, and you can basically have a look at it. And then how many of you have even seen or heard of polio infection nowadays? I've been a doctor for the past 20 years, and then I have only personally seen a few cases of polio infection. Very fortunate that we are able to have this polio vaccine that was invented back in 1950s. So this is just one of the many examples that vaccination can eradicate a disease and save life. Vaccines are important. So why are vaccines important? Because it can prevent morbidity and mortality, and to achieve herd immunity and prevent ongoing transmission. When a person gets vaccinated against a disease, the risk of the infection is reduced, and even when they get infection, the symptoms would not be so severe or life-threatening. Just in the case of COVID-19 vaccines over the past few years. Remember, when COVID-19 first struck us, a lot of people died. And when the vaccinations have been invented and people start to get vaccination, the mortality rate and the morbidity rate are actually getting lesser and lesser. I have personally encountered it myself as being a doctor, so I can understand how important it is to get vaccinated. I cannot tell you how many deaths I've seen in my patients before the COVID-19 vaccines are available. But when the COVID-19 vaccines have been invented and has been given to the general population, you hardly see a person dying from COVID-19 infection nowadays as compared to just about 2-3 years ago. It's really a miracle. Vaccines are important. These are just a few statistics to show you again how important vaccines are. So to give you an example, there are multiple diseases that can be easily prevented by vaccines. So, for example, for Haemophilus influenza B infection and pneumococcal diseases, both of these can cause pneumonia. Annually, there are about 600,000 children who die from these two infections alone, just because they don't have the opportunity to get vaccinated. And then you have got about 200,000 deaths per year from pertussis, measles, and tetanus. Rotavirus, which is a very, very simple virus that can basically cause severe diarrhea, can be prevented by a very simple vaccine. But then about 500 million child basically die every year because they are not able to get vaccinated, or their parents refuse to get their children vaccinated. The so-called anti-vaxxers, which are not very smart people, to be very honest with you. If you have been paying attention, about a week ago, Malaysia started reporting a couple of dozen of pertussis infection, and I just worry that this is going to get worse. These are the problem, these are the consequences of anti-vaxxers, or some unfortunate parents who really, really wanted their kids to be vaccinated, but they don't have the revenue. They don't have the chance of doing so because of logistic and because of other reasons. But mind you that the vaccination program of Kementerian Kesihatan Malaysia is all free. So a lot of us really, really don't have excuse not to get our children vaccinated, because the government is providing all the vaccines for our children for free. Vaccines are important. It's basically a very simple process. It works by introducing a harmless form of virus or bacterium into a person's immune system. So a healthy person's body recognizes the foreign antigen as unusual and responds by devising a defense immunity against it. So it really, really costs very little to get this vaccination. These are the price tag in American dollars. But then again, our government is so good that they buy all the vaccine and give to the Malaysian for free. So you should appreciate it, and you should follow the vaccination program as recommended by Kementerian Kesihatan Malaysia. So I think I have explained already, but this is a simplified version. So you are given a small amount of harmless form of a disease in the form of bacteria or in the form of virus. Then your body makes antibodies to fight off. So when you encounter the disease again in real form, your body already has the antibody so that you don't get sick or you don't get very sick. In other words, you are immune. There are many types of vaccine. I'm not going to go through that. In fact, there are a few more types recently. For example, the COVID-19 vaccine, few more newer vaccination that doesn't belong to these few traditional types. This is the Jadwal Imunisasi Kebangsaan by the Kementerian Kesihatan Malaysia. The vast majority of these vaccines are free, with the exception of a few optional ones. So we as parents don't have excuse not to get our children vaccinated. Take-home points: vaccines are safe and effective. Any licensed vaccine is rigorously tested before it is being approved for use. Regularly reassess and constantly monitor for side effects. If in the rare event of a serious side effect is reported, it is immediately investigated. So there are a lot of conspiracy theories around, but none of those are true. As doctors, we know any medication, including vaccine, if we have been giving this similar medication or vaccine to patients, even after a few years, few decades, just in case there is some unpredicted side effect happens, we can actually report the side effect to the authority, and this side effect will be promptly investigated. So very safe. Number two take-home point is vaccine prevent deadly illnesses. So as I elaborated just now, a lot of illnesses, a lot of diseases can actually be prevented just by getting our children vaccinated. And those who don't get their children vaccinated will risk their children having to die from these infectious diseases. Number three, vaccines provide better immunity than natural infections. The immune system response to vaccine is similar to one produced by natural infection but less risky. For example, natural infection can lead to cognitive impairment from Haemophilus influenza B that causes pneumonia and meningitis, and also birth defect can happen from congenital rubella infection or irreversible paralysis from polio that I was mentioning just now. So if you get these diseases and get immune, maybe you would not be healthy anymore to live your whole life. But if you inject and vaccinize yourself or your children against this infection, not only is very safe, but you can live a normal life. Because the chances for you to get this infection will be extremely low or none. Even if you get certain diseases after you are vaccinated against it, then your symptoms will be very, very mild. Take on point number 4, combined vaccines are safe and beneficial. I'm not going to elaborate more into that because a lot of vaccination given to our kids nowadays are combined vaccines. So to save the time and the efforts for the parents to bring their kids for vaccination. For example, mumps, measles, rubella can be given in one single injection. And for example, diphtheria, tetanus, and pertussis infection can be prevented by a combined vaccine. Number 5, if we stop vaccination, diseases will return. One of the examples is, as I mentioned, pertussis. Just this past week, a lot of cases, a few dozen cases have been reported in Malaysia. So do the right thing, get yourself and your children vaccinated, especially bringing your children to get their vaccination according to the immunization program as suggested by the Kementerian Kesehatan Malaysia. So with that, I thank you for your attention.